Well, this is awkward. We thought we were going live today on TikTok, but one of the problems of having people in their 40s running the social media accounts is that we didn't realize that we didn't have enough followers to go live. So we're just going to make some recordings here and then share them on TikTok as though this is just a live performance.
100%. And just to be clear, we're doing this live right now. Like, this isn't a recording of a recording or anything.
Yeah, no,
100% live.
Yes, I'm sure you can probably tell this is very polished. And,
yes, and this is how we intended our live to be. We wanted it to be like really impressive and
yeah, totally.
high resolution.
Yes.
I think it might be VR actually.
It's probably VR.
Yeah, if you have a headset, it's like you're sitting here with us.
AR is a thing too.
Is that?
Well, maybe. Who knows? QR codes.
We're just going to become digital codes.
Yes.
But we're here to talk about male contraception. I believe was
Absolutely.
the intention. So.
Yes, and today, for those of you who don't know, is a very, very special day for our field. Not just male contraception, but family planning in general. Because today, September 26th, is World Contraception Day.
Woo!
Yeah, woo! So, unfortunately, a lot of times when people talk about World Contraception Day, the focus is on just female methods of contraception or methods for egg producers. So we at MCI wanted to make sure that we came on here to talk to people, especially younger people, to let you know that there are male methods currently in development, some very far along that are actually in clinical trials, and others that are earlier stage. So hopefully in the near future on World Contraception Day, we'll be able to share information and news about the latest male methods that have reached the market.
Yeah, and I think that, one of the important things that we had hoped to talk about today, and we were really looking forward to taking questions, but I think one of the biggest questions is when do we anticipate that these methods will be available? And, we always get to be the Debbie Downers of the contraceptive space, and, you'll see these articles where, there'll be some sort of advancement at the bench and media will be like, oh my gosh, this is right around the corner. And then we always follow up with like,
yeah. To douse that with some truth.
It's true. And so, the development process takes time and you want these methods to be safe and effective. So realistically, even the most advanced products are probably a good 5 to 10 years away from the market. But the momentum is there. And this is what's kept male contraception out of the market for so long, is that I think this daunting timeline really shuts a lot of people down. And, it's one of those things, if you don't invest now, then you're not going to have the results later. So,
I think this is a good opportunity since, and we were remiss at introducing ourselves. So
Hi, we're just random people who feel obliged to talk about male contraception.
Yeah, so.
And my dog's here tormenting Kevin.
Yeah, so we have some four-legged friends.
He was supposed to be cute for the live stream. Now he's just kind of challenging.
Yeah. So I'm Kevin Shane, and I'm the Communications and Design Director at MCI. And
I'm Heather Vahdat, and I am the Executive Director at MCI.
Yeah. And you have with you right now 40% of the entire company of MCI. There's only 5 of us that are doing this very, very important work. So,
but we are 5 fabulous people.
5 fabulous.
And humble.
So, yes, and obviously very good at social media. So that helps us.
It was between male contraception and social media.
It's either influencers or nonprofit people. It'd be a good opportunity, since we can actually receive questions from those who are watching this. I would love for you to explain more, like, why are the timelines 5 to 10 years? Can you help people understand, like, what is it that takes so long for this?
And I think that, so you have the time where you have a scientist who finds something that looks promising as a contraceptive that has some sort of molecular indication that it prevents for instance, in our case, it could be it impacts how sperm swims, something like that. And then they go through a process of optimizing that lead to make sure that it is what it appears to be. So a lot of time at the bench, that takes, sometimes a couple of years. And a lot of our products are kind of beyond that in our pipeline, are beyond that at this point. This also feels like an appropriate time to pause and mention that Male Contraceptive Initiative, our organization, focuses exclusively on non-hormonal methods, and for no reason other than we have colleagues who are doing great work in the hormonal space. So this is where the need was, and that's where we focus. But then once you have a good candidate molecule, then you need to go through all the process of the preclinical stages where you're doing in vitro and in vivo testing to make sure that preliminary, sort of big ticket, I'll call it, safety things are there. Like, if you take it, you don't spontaneously combust.
Sure,
I mean, things like that
Always
are good to know. Yeah. So, and then you get into the clinical stages, which, I think the classic thing that people think of is phase 1, 2, 3. And, you can just imagine that you have to increase the number of participants for each level. And, so you've got recruitment, and then, it depends on the length, the intended duration of use of the method too. So if you have something that's meant to last for 3 years, for instance, you're going to have to recruit someone into a study, follow them for 3 years, and then follow them for certainly at least some time afterwards to make sure you have return to fertility. So that could be anything, 3 months, 6 months, whatever. So when you look at that timeline together, that's for each person, you're looking at potentially years of follow-up. And so that alone adds to the timeline. So there's just some things that you can't expedite safely.
No. And I think that duration of use is a very important thing for people to understand, especially for the more long-acting methods. So some of our grantees are working on some things that could last upwards of years. So again, as Heather was saying, you have to start with a smaller catchment of people, and then if it proves safe and effective for them, then you test it in a larger catchment, and then more and more until you're absolutely as certain as possible that this is safe, effective, and should be used by people. And one of the reasons why, again, if you're a general user of TikTok, it tends to skew more towards younger people. But
first of all, call us because we seriously need help.
we could use your help. But one of the reasons why MCI, why we were so committed at being present on TikTok, is it does reach a lot of young audiences. And what we often say, because of these timelines, these development timelines, today's youth will be tomorrow's users of the methods that we're providing funding and advocacy support for. So if you are a young person, you're in high school or college right now, it's really, really important for you to get involved, to lend your voice to the cause, to really question why these methods don't exist, and to look for opportunities to engage with organizations such as MCI and other nonprofits that are working at trying to address this gap. Because as Heather said, there are things that we can accelerate and there are things we cannot accelerate. But one of the things that will help us move things forward quickly, or more quickly, is if our elected officials, the people who control budgets that support these things, are hearing from a lot of people. They're seeing this in the news, that there's a huge amount of demand for this. And I know that we have done at MCI some things around market research and demand forecasting. I'd love to, although we're not releasing the information yet, I would love for you to kind of tease a little bit of what's to come in the near future from MCI.
Right. It's funny, we keep saying, well, first of all, you brought up youth, so I do want to touch on that real quick, which is we have a youth advisory board. So for young people that are interested in joining in and trying to see how they can be engaged or to learn skills, we let our youth advisory board have some review capacity with our, not the grants themselves, but the letters of intent that come in. So we're trying to help them see what it's like to submit a grant and to what the review process looks like. So we try to make it really a useful engagement, but and then of course we get their input and their perspective, which is really important to us. So we have a really active and awesome youth advisory board. Shout out to all of you guys. It's probably like they're like, I don't know this. It's like it's your mom saying, "Hi, honey."
Well, hopefully this will inspire them to take over TikTok for us, so we don't have to do this anymore.
You hear a record scratch and then they break in now. They're like, okay, the pain's done.
Yeah, it's over.
But then, so the market research, and it's funny, we say we haven't released it except all the times that we have.
We have, yeah.
And that's our colleagues that have done that amazing work, our colleagues at Estonia Impact and Outside for Development and Desire Line. And, you can find some webinars. We've done a webinar presenting the early data on our Lemonade Stand part of our website. Lemonade Stand is what we call our webinars. There's been a WHO webinar. Our colleagues at the Initiative for Multi-Purpose Prevention Technologies have done a webinar, but basically and it was co-funded with our colleagues at the Gates Foundation and with MCI. So really looking at 6 countries around the world and male interest in and female interest in male contraceptives, future male contraceptives, and the data were just phenomenal. Like, the biggest question that we really were impressed by is, I think in each country they surveyed about 2,000 people. And they asked them, if this method, they went through some potential methods that are in the pipeline. So just sort of hypothetically, here are these methods. If this was available within 12 months, how quickly would you use it once it hit the market? So I don't think I said that very clearly, but like once it hit the market, how quickly within the first 12 months would you use it? And I think in most of them, certainly more than 50% in all of the countries at this point, I think. Some countries like Nigeria and Bangladesh, I think 60 plus % of the men surveyed said that they would be interested in using it in the first 12 months. I mean, when you break that down into numbers, it's just phenomenal. And I think as a woman, I find this to be a really interesting conversation because it's so dichotomous. Like we think of contraception as female only. So we're really working to change that. Contraception is about preventing unintended pregnancy. It takes two people to create a pregnancy. It should take two people to, time and space and decide whether or not you want a pregnancy. So the women were also very keen for this to come out. And so even though we're talking about male contraceptors or sperm producing contraceptors in these contexts, we are preventing unintended pregnancies, which are still over 120 million around the world every year. So that's a massive opportunity that we have before us.
Yeah, and I think, as we're rocking some of our MCI merch here today, our vision statement is reproductive autonomy for all. And a lot of times people ask about that since we're only providing funding and advocacy support for non-hormonal contraceptive methods for men or sperm producers. That why are you saying reproductive autonomy for all? Or don't you mean just for men? And the reality is no, it's that right now no one has reproductive autonomy, and that's because men have to trust in a heterosexual relationship a female partner to take something to avoid an unintended pregnancy. And conversely, women or egg producers in a heterosexual relationship have to take something in order to prevent this. So you don't have the choice to not take something and still be protected. So what we really want to do is change that dynamic and make it more equitable so that it's not an either or situation. It could be an and. So wouldn't it be great, as we often talk, there aren't really any methods that are 100% effective outside of permanent sterilization. So wouldn't it be great if a man was using a method that they preferred, his female partner was in a heterosexual relationship, was using a method that she preferred, and then we're all safe. So I think that's what we're working towards, is really reframing the conversation of who's responsible, who participates, to break down any sort of barriers for anyone to engage in family planning in a meaningful way and in a manner that is in line with their interests and needs.
And I think talking about sort of the relationship aspect of this too, one of the big things for us in saying reproductive autonomy for all is ostensibly when you think of a spectrum of contraceptive options, there's people that have been overlooked for years, not just traditional males in a heterosexual relationship, but the trans community who are taking hormonal products.
Absolutely.
Having non-hormonal contraception is an option that they can use. That's something that's not available to that population. So we really do see that completing sort of both ends of the spectrum covers everyone. And so I think the potential even surpasses what we immediately think of when we're considering a future of expanded contraceptive options, excuse me. So that is, and Kevin gets credit for coming up with that slogan, and it's been wonderful. It's easy to get behind. It's hard not to say yay reproductive autonomy for all. So.
I know. We often joke that we're waiting for our Greta Thunberg, the youthful champion that's going to take this mantle up as their cause. Because there certainly should be someone, and it's a worthwhile one at that. If you go to our website too, I think one thing that people kind of zero in on is, we obviously talk a lot about preventing unintended pregnancies and empowering people to have children, or whether and when to have children is up to them. But there's other impacts that these methods can have on the world that all of us should be supportive of, including helping to meet some of our sustainability objectives. So we have a whole section on our website talking about how male birth control methods can help us achieve each of the 17 Sustainable Development Goals, for example. So it's much more than just facilitating risk-free sex. It's really about reframing how we think about society, how we think about people's roles within society, how we think about empowering ourselves as well as each other to live the happiest, fullest, freest life we possibly can. So I think, that's definitely something everybody should be supportive of.
Yeah.
Yeah.
Again,
Yeah.
not hard to get behind.
No, totally. And I think one of the things that we really wanted to stress as we're talking to you today on World Contraception Day is, with such a massive challenge like this, it's easy to get overwhelmed and feel like there's nothing I can do. Like, this is just too big of a problem for me to handle. And again, there's only 5 people at MCI, so it's incredible what a few dedicated people can accomplish in a given amount of time. But it's also, we have myriad opportunities for you to engage with us directly as advocates to kind of lend your voice to the cause, to make sure that, again, your elected officials, the powers that be can hear you, but also that we can share perspectives with the development community so that they understand as they're working on these methods, what are your interests, what are your needs and desires vis-a-vis contraception, so that as we're developing them, that those interests and those kind of demands are kind of built into the development process. So we highly recommend that everybody pay a visit to malecontraceptive.org. Check out all of the wonderful information we have available there, and also really think about, like, how can I get involved, and how can I, outside of just making a donation, how can you roll up your sleeves and create some content for us and with us, or just be that empowered advocate to help us achieve reproductive autonomy for all.
That's so true. And one of the things that is actually very helpful to us is the voice of other people. So, we have multiple ways that we can actually use input from folks who are just supporters or potential users. We get emails all the time from people asking, when are these methods available? My partner and I are really struggling. And so those sorts of examples and people willing to share their experiences is really helpful. So we have video asks that we can do. Come write a blog for us about your experience.
100%.
I mean, again, with being 5 people, we've been very open from the get-go of, like, this, it takes everyone.
Yeah.
So if anybody calls us and says, how can I help, we do our best to try and accommodate.
Yeah.
I think one other thing too that I find interesting is in the context of, talking about donations, which feels, obviously we're a nonprofit, that's part of what we do, but I think it's really important to understand that we're talking about a pharmaceutical product with a contraceptive, right? But I think a lot of people don't understand that the development of these products is not supported by the pharmaceutical industry at this stage. So, this falls into, and this happens in a lot of different therapeutic areas, but the pharmaceutical companies are more looking for their risk to sort of be mitigated. So it's this de-risking idea where, the nonprofit and the public sector are paying for these early development stages and, pretty far into clinical in most cases, before the pharma groups will step in and take on licensing and maybe finish up some of the clinical trials, but do the marketing and the distribution because they have all of those channels. But so, we're currently the 2nd largest funder of male contraception in the world, I think. And we're so proud of that, of course, but I think, we immediately feel compelled to put, a layer of clarity. Yeah, definitely. Sort of like, hey, isn't that cool? And it's like, yeah, and we fund about 1.25 to 1.5 million in grants every year. And you have to imagine that's going to multiple organizations. So sometimes 3 to 4 different organizations. In the context of R&D for pharmaceuticals, we always say it's a rounding error. It's a drop in the bucket. So, we have been supporting a field that is emerging, but it's really gotten momentum, and we're reaching those later stages that are going to be more expensive. So we're always looking for investors and donors, people who say that they're interested in impact investing. This is where that's at. Kevin talked about the Sustainable Development Goals. For us to be able to bring additional methods into the method mix to address unintended pregnancy is just a tremendous trickle-down domino effect, any sort of metaphor you want. I mean, you are having an economic impact on families. They're able to provide better education for their children. fewer maternal and child mortality outcomes, which I think, again, everybody can get behind. So, an unintended pregnancy it's a huge hit to a family. Obviously the mother carrying the child, it's a physical and emotional and lifelong risk, and the child has medical risks. And one of the things we're trying to also elucidate is that there is an impact on men as well. I think we've
100%.
often sort of forgotten that because there is no biological association with a pregnancy, but men do, have an impact. Not all men are what we've sort of reduced them to as the lowest common denominator. There are men that are shockingly care about their partners and don't want them to be sick. And I think you might kind of like your partner, don't you?
Well, it's
she's pretty cool.
Yeah, she's pretty cool. Working in this field is amazing because you will have people come right up to you and say like, yeah, but men aren't interested in this, right? And you're like,
and to you,
I am.
You're like,
so yeah,
one is.
and I think that's you mentioned my wife, and I think what's amazing is she's probably the first person in my life that I actually had a conversation with about what our experiences were like using our different methods of birth control. And I think that's something that we'd like to challenge heterosexual couples out there, is to really how often have you had those empathy building conversations where you ask someone else, what do you use, why do you use it, what is that experience like, what have you used in the past, what have those been like? And on the flip side, especially for men, to hear things like, well, beyond beyond condoms, what would you be interested in? Are you interested in a long-acting method?
Yeah.
Are you interested in something that's, on demand, or that just goes away immediately, or a pill, or an injection, or this and that? The more that we have these kind of conversations, and the more people question what they need or what they want and what they're interested in, the more it will help us as a field just move forward in a more equitable and empowered manner.
Yeah, and empathetic.
I
think that's a big part too, is I think because, embrace the awkward conversation. We talk about this stuff all the time. It's very hard for us to find. I was just telling someone that part of our performance evaluation is the mastery of innuendo and juvenile jokes, but truly, it is sort of easy for us to talk about this stuff, but it's actually fun when you have the awkwardness of it, and it breaks down that barrier pretty quickly. But I think one of the things I'm often surprised by is because we've alienated, men from the conversation so much, they don't necessarily understand the full scope of side effects too. So it's an opportunity to understand what your female partner might be going through with side effects. And so I do think the conversation element is good, and it's hard to have a conversation about something that you don't have context around, right? Totally. When you're like, well, I can talk about condoms or vasectomy, but those are very different from any of the female, right? It's not like taking a pill every day. It's not like having an IUD inserted. It's not like, having an implant in your arm, all of these different things. So,
So I think, what we've been trying to do with TikTok and our other social media accounts is to really present this kind of bite-sized information about the myriad kind of touch points that male birth control and family planning have on our daily lives. So we invite you to share this with your friends and family, to reach out to us, to add your voice, to have conversations with us if you're willing to and want to embrace the weird a little bit. And
that's our next slogan: embrace the weird.
Embrace the weird, totally. But also, as you can see, we're just regular people that are trying to make a significant difference in the world. So we're keenly interested in talking to other regular people out there who are willing and interested in joining us in this very worthy cause. So again, don't hesitate to reach out to us. If you do reach out, you contact at malecontraceptive.org. It's going to be one of us who's responding.
But that's a little, what is it? It's like the Wizard of Oz. It's like a
behind the curtain. Yeah, exactly. So thank you very much for joining us today. On our TikTok on World Contraception Day, and sorry we didn't go live. We're not able to yet, but hopefully one day in the near future.
Well, I was just gonna say, if you can, let roughly 800 of your friends know we can go live next time. So.
Like and subscribe or whatever they always say. So, yes.
There's buttons here and here and here.
Totally.
Anyway, Thank you.
Thank you very much.